this is Dr. Michelle at Valley Vet, and today I was going to go over with you guys something that I see every day, multiple times a day, and probably makes up about 25% of our appointments here at Valley Vet, and that's itchy dogs. So if you guys like this video, we'll definitely go into a video about itchy cats, but for right now we'll focus on dogs because we got plenty of things to talk about there. So for the main three things that we see, I'll go over kind of in order of which one I see the most down to the least. And then I'll go into each topic individually to kind of give you guys an insight of maybe why your pet might be itching and things that we can do about it. So for the top three things that I see, the first one, the most common that I see all the time is allergies. And we'll go into that in just a little bit. The next one I see is fleas. And the last one that I see is mites. So to start this off, we'll go into the third topic here just because it's the least important, then we'll go to the most important, and that would be mites. So there's two different types of mites that I'll see in dogs most commonly, and those are Demodex, and then the other one is Sarcoptic mites. And Demodex, I typically see it's usually a young dog disease, and it tends to be kind of associated with their immune response, and I usually see this most commonly in pit bulls or very common, but I can see it in other dogs as well. And Demodex is a normal mite that we all have, even we have it, but what's happening is these dogs have an overproliferation of that type of mite, and most of the time it's not itchy, but I have seen several dogs that come in with the complaint of itching, and we'll do a skin scraping and we will find Demodex. The good thing is we do have some really good treatments for it, and usually with increasing age and medication, they clear up just fine. Sarcoptic mange is another type of mange that you've probably heard of before. It's the one that most people associate with the term mange. And it is something, it's a mite that everyone can get. It's not one that we normally have, but it's one that you can get that I usually see in dogs, not so commonly in cats. It is a difficult mite to, I would say, diagnose, because you can do, say, 100 skin scrapings on a dog and still not have a mite show up, but still be positive for sarcoptic mange. So oftentimes when we're treating itchy dogs, it works into treatments that we're already doing, but we do treat for mange just in case. That one is extremely itchy, and so these dogs are miserable. Oftentimes we'll ask if other animals or people in the house are also itchy, just because that is one that is contagious and can be spread from person to person, but also something that we can treat and cure, and luckily isn't the major reason why we see itching in this area. So the next major reason is fleas. Unfortunately, in this area, we have a ton of fleas. We do have some doctors that graduate or practice in other areas of the country where they don't have fleas, which is awesome. But in this area, it is something that we see, unfortunately, all the time, year round, no matter what. There's no frost that gets rid of fleas. Fleas can actually live in your house for up to a year, and they will hatch in their egg form by pressure and CO2 changes. So it's really creepy. They're like ninjas. They'll get into the farthest corner of your piece of furniture that you never step on, and then 6 months later you do and you have a flea issue. We'll have people that come in here to get flea treatments for their house, and they don't even have any animals in their house. So fleas are a huge issue. And yes, there are dog and cat fleas, but they interchange among each other, so it's all around, just got to treat the condition itself. And so there's two things for fleas in general that for curing it that you guys really need to know. The first one is always make sure that you're using a safe approved product. There are some products, even at your local grocery store, that are not very safe, and some of them, especially if you use them with cats, can actually kill your cat. And so you want to make sure you have a really nice safe approved product. Obviously all the ones we sell here are extremely safe. We would use them all on our own dogs, and we make sure that that's our main standard is safety, and they work very, very well. So you want to make sure you get a safe product that is very effective. The next thing, and this is the big deal here, is there are a lot of dogs that will not only have fleas, but they will actually be allergic to those fleas. So you may have a household where you say, I got 3 dogs, they all got fleas, but only Bosco here is itching like crazy and rubbing all his hair off. And that's because Bosco has a sensitivity to that flea. So the main key here, because we're gonna go into allergies in a second, is that if you have a dog that's allergic to fleas, or just fleas in general, because fleas are gross, treat everyone in your house. So even that cat that barely comes in but sometimes comes in from outside, you need to get that pet on flea meds. Because like I said, cat and dog fleas, there is a difference. but the flea doesn't care if it's on a cat or a dog. And if Bosco's allergic to fleas, even if you have him on flea meds, the unfortunate thing is with most flea meds, they still have to actually have contact with the animal and bite to die, and that's still gonna stimulate an immune response, and he's gonna go into crazy itching style again. So make sure you treat your cat too. So treat everyone in your house. Even if you have an outdoor cat, get him on some flea treatment so that you can get Bosco feeling better. And frankly, fleas are gross. You want to get them out of your house. And usually, if you do have a flea issue, it's going to take at least 3 months to get it under control. So the best thing is prevention is key. If you can have them on a monthly preventative or every 3 months, whichever type of preventative you have, and before you have a problem, it's going to save you from running into a situation where you have fleas in your house for an extended period of time. So the number one thing that I usually see in this area is allergies in general. And there's a couple different types of allergic conditions that will cause itching in dogs. There's about 3 most common ones, and those would be kind of like a contact dermatitis and atopic dermatitis. And then the other one would be a flea allergy dermatitis. And then lastly, I will throw in a food allergy dermatitis. A lot of people, at least what I hear when clients come in, is the first issue is they go, I have this really itchy dog, I changed the food, I went to a grain-free diet, he's still itching, what's going on? And so when we talk about allergies in this region in particular, and that's Oregon and Washington, we have a lot of contact allergies. So just like people who are allergic to all the different types of grasses and trees outside, animals are as well. And they're even allergic to things inside too. Dust mites, mildew, mold, all of those things will cause dogs to have an allergic reaction. Now, we do have food allergies, but most of the time food allergies are a component of the overall allergy issue and make up only a small percentage of that issue. And when we talk about food allergies in general, it's actually the protein source that are the most common cause of food allergies and not the grain source. We do have corn allergies, but if you look on the scale of things, usually beef, poultry, soy, and fish are the most common causes of allergies, and that's because these protein molecules are much larger and stimulate a reaction compared to the grains. But the biggest issue is we don't know what they're allergic to. And they do have allergy testing, but it's not accurate for food allergies. And so what we can talk about is doing kind of like a food trial where we will eliminate all of the things that could be causing an allergy with a specific hypoallergenic diet, and then introduce protein sources each week to figure out which one triggers a response. But that's a topic for a later story. Most of the time, like I said, it's usually not food related, although if I do have a dog that's coming in that's very, very itchy and also is having chronic diarrhea, I would stick to doing a food trial probably earlier than I would with most of my cases. Most of my cases are one of 2 things. Either something outside's bothering them, or something like a flea allergy is bugging them, or it's both. And so what we do for that is a couple different things. The one thing we need to do is stop the itching. The itching, when they start having that immune response, whatever triggers them to start itching, they scratch on their skin and they over-proliferate the normal bacteria and yeast on their skin. This causes a secondary infection. You can kind of see that brown discoloration on their skin, the red scabs and pustules, and what that results in is a secondary infection that is also itchy. So they're itchy because they have an immune response, they're itchy because they have an infection, they're miserable, they're keeping everyone up at night, everyone else is miserable too, and so what we really need to do is get them to stop itching and clear up that infection, and then try to figure out what caused the underlying issue. And unfortunately in this area, it's a lot of the things outside that we can't change. So then what we'll do is go into a management plan on how to keep your pet itch-free with the least amount of medications needed to do that. And luckily, because this is such a big issue, a lot of the companies have come out with some really great products in the most recent years here that are extremely safe and work very, very well to control itching. So the key point here is if you have a really itchy dog, check it for bugs, bring it into us, we'll help you treat it, we'll help you diagnose it, we'll get it under control and get it so everyone can have a better night's sleep, because itching is terrible. Well, I hope you enjoyed this today. I think I went on a little bit of a tangent with itching, but it's something that we do see all the time, and it's something that I think is really important, and there is things we can do about it, and there's a lot of things we can do about it. So depending on the severity and the degree, we can stage it out, figure out what works best for your pet, and get them itch-free. Well, thanks for visiting us again today, and I hope to see you guys in the clinic.